Radiology enthusiasts. Welcome back to RadManPulse, the channel dedicated to making radiology concepts simple, approachable, and maybe even fun. Today, we're tackling a core topic that every beginner in medical imaging needs to know: the 5 densities of radiology that show up on X-rays. Understanding these building blocks will take your X-ray interpretation skills to the next level. Ready? Let's jump in. Let's start with the basics. X-rays capture differences in the density of structures within the body. These differences determine what we see, ranging from black shadows to bright whites. Here's your crash course on the 5 densities you'll need to spot. Air is the least dense material. It lets most X-rays pass through, showing up as deep black areas on X-ray films. You'll find air in the lungs, intestines, and sinuses. Next time you see a chest X-ray, look for those inky black lungs. Fat is a step up on the density scale. It absorbs slightly more radiation than air, appearing dark gray on X-rays. You'll see it around muscles or organs, helping to separate soft tissues for clearer imaging. Stay tuned as we explore more densities and how they impact your understanding of X-rays. These are mid-density things like muscles, blood vessels, and organs. Soft tissue shows up as light gray, and fluid like blood or edema also fits into this category. Now we're getting into the bright stuff. Bone. Bone is dense and absorbs more radiation, resulting in the bright white appearance you'll see in skeletal X-rays or even pathological calcifications like kidney stones. The heavyweight champion of density. Metal absorbs almost all the radiation, appearing stark white. Think surgical implants, bullets, or contrast agents used to highlight areas in certain imaging studies. Let's bring each of these to life with real X-ray images. Now that you understand the 5 densities, let's apply this knowledge to common X-ray cases. Notice how the lungs, air, contrast sharply with the heart, soft tissue, and ribs, bone. Here's where you'll spot intestinal gas, fat layers around organs, and the spine all in one view. These are a bit dramatic. Bone cracks show up clearly in white, while surrounding soft tissues may indicate swelling or injury. Pro tip: developing an eye for these densities is crucial when reading more advanced imaging like CT scans, which build off these exact principles of density. All right, you might be wondering, why is learning about densities such a big deal? Well, understanding these 5 categories is the foundation of radiographic interpretation. Whether you're diagnosing a fracture, identifying pneumonia, or spotting tumors, everything starts with recognizing density differences. This knowledge helps you transition seamlessly into interpreting CT scans, where we analyze slices of density. Plus, understanding densities can help you prepare for even more advanced modalities like fluoroscopy and MRI.